Hey there, all my bariatric brothers and sisters. Nurse Mike here, World Heavyweight Champion of Nurses. And yes, this is the United States Championship belt, new belt today. And I like this one. So I just spent the weekend competing in my second Spartan race. Completed it, did most of the obstacles, but I finished it. And that's the important thing. This one was nice because it was part of the honor series of races held at military bases all over the country. So this one was at West Point, so that was fun. So today, what I want to do is a little Q&A. I've been scanning the message boards and the gastric sleeve and bariatric websites for questions that I'm seeing a lot. I'm about May, June, July, August, September, about 16 months post-op. Stats. Historic weight 350, surgery weight 314, lowest weight 179, and this is what I look like. Okay, current weight 210, and this is what I look like. Now that's an important thing to note because that's 30 pounds difference, but the big thing on that, and I've said this before and you guys know this, my weight has gone up, but my waist has remained the same and actually gotten smaller. I'm a size 32. So, you know what? Come here, come here, come here. Oh, it's my dog. This is Jax. She might have to go out. So if I have to pause the video for a sec, we might do that. Hey, puppy. Hi. Hi. Can I kiss? Can I kiss? No? All right, so Jax is going to hang out with us. So anyway, I've been looking at the boards and I found a whole bunch of questions that are very common, and I thought I'd try to answer a few of them as best I can as Nurse Mike, as a bariatric surgery patient. Understand, the answers that I give to some of these questions and some of these things I've seen are based on my experience, on what I've gone through and what I've been through with my surgeons. They may be different for you. They may be different for your surgeons. Any questions, at the end of the day, talk to your doctors. Okay, so first one, if you're just starting out, yes, you will probably have to do a liquid diet. The length of that varies. Can be 2 weeks, can be a week. Usually it's protein shakes. Some places allow a small meal, like a salad or something. Talk to your docs, but yes, you will probably have to do some sort of liquid diet. The reason for doing a liquid diet is not necessarily weight loss. It's more specifically, from my understanding, to help shrink the liver in anticipation of doing a surgery such as we do. You don't want a fatty liver. It's never good. Doing the liquid diet helps to shrink some of the fat off the liver. So there's that. Give me 1 sec. I'll be right back. Sorry about that, guys. Dog had to go out. So that's the liquid diet. Yeah, you're probably going to have to do one. Let's see. Oh, if you're just starting out, I know a lot of people talk about a pouch reset. Forget that. Forget doing a pouch reset. Forget doing any sort of reset. We do this surgery as a lifestyle change, to change everything about us and the way we eat and the way we take in food. There's no such thing as a pouch reset. Your stomach doesn't magically shrink because you're back on a liquid diet. And, in fact, what's the point of doing that? So you've been eating like crap, you've stretched your stomach, your sleeve, or so you think. So now you think that doing 2 weeks of a liquid diet is going to shrink it so that you can eat like crap again. Think about that logic, guys. Throw the pouch reset out the window and just eat right. Thinning hair. I'm not really an expert, just what I've seen. Yes, you can have some thinning hair, specifically for the ladies, guys too, I suppose. But yes, you can have some thinning hair after surgery. The reason being that the nutrients that we take in that supply your hair, we take in much less, so your hair can thin. Let's see. Oh, pre-op testing in terms of what's required prior to surgery. Now, this is all dependent on what type of insurance you have or what your doctors require. If you're self-pay, it may be different. If you have insurance, usually they require some sort of doctor-followed like a doctor followed weight loss program. My pre-op regimen was obviously my doc, my 6 months of supervised weight loss, cardiology, pulmonology, primary doc, psychology, nutrition. You had to get clearance from all of them. Psychology, for me, I mean, it was a 1 hour visit with a psychologist. I think it was a psychiatric NP who basically, tries to find out if if you want to do this and if you're willing to make a lifestyle change. Cardiology, it's an EKG, maybe some blood work. Pulmonology, can you breathe? It's basic stuff. What's required from your insurance company may be different for you. And to that end, the other question, will insurance cover it? I don't know. I don't know what insurance company you have. I don't know what your plan is like. Inquire. Call them up. Find out. And you want to find out, A, if they're going to cover the surgery, B, if they're going to cover an in-hospital stay, which leads to the next question, how long will I stay in the hospital? It varies. I know some patients are in and out same day, not many. Most, it's overnight. In my practice, it's 3 days. You go in, have surgery that day. The next day you do your leak test, and the morning of the third day you go home. So 3-day stay for my surgeon's practice. Let's see. Gas pain. And again, a lot of these I know are for newer patients. So if you've had the surgery and you've gone through all this, great. Gas pain. Very possible, okay? When you have post-op pain, it's important to distinguish whether it's, there's different types of pain. Is this incisional pain? Does it hurt on the surface where they put the trocars in, where they put the instruments in? Is it pain at those surgery sites? Or is this deeper pain, like within the sleeve, which may indicate a sign of something not quite right? And then there's gas pain. Gas pain can be in the belly, can be all over the abdomen. Gas pain also, and very commonly, can be felt in the left shoulder. Don't ask why. It's called referred pain. It's gas pushing up on the diaphragm, innervating the nerves of the diaphragm, which affect the left shoulder. The solution to gas pain usually is ambulation, walking, a lot, and sometimes some people may use like Gas X strips, things like that. Check with your doc. But you might have gas pain, and it might be pretty severe at times, but it does pass, okay? Let's see. I like this one. Constipation, or my first bowel movement after surgery. I think for me, it was 7 days till I had a bowel movement, and I started to freak out too. I called my surgeon. I said, dude, I haven't pooped in a week. Not uncommon. Understanding that you're not taking in any real solid food, there's not real solid food to put out. If that continues, weeks, months, post-op, you're having troubles going to the bathroom, increase fiber, increase liquids. That should help move things along. Do not jump to laxatives, please. Do not jump to stool softeners that quick. And again, consult with your physician. I'm going along, so I'm just going to touch on one more. And a lot of people are asking sleeve versus bypass. Understand that when you ask that question, you have to understand the difference between the two surgeries. The gastric sleeve surgery is not a malabsorptive surgery, and the gastric bypass is. And what that means is most of the nutrients in your stomach are absorbed at the pylorus, which is the base of the stomach and the entry to the intestines. I'm being very basic here, but that's the general idea. Most of the nutrient absorption takes place at that crossover between the end of the stomach and the beginning of the small intestines. The sleeve doesn't remove that. The sleeve cuts out a lot of the stomach, but it leaves that juncture intact. The bypass bypasses that. It eliminates that. So you have to do a lot more vitamins and nutrients by supplementation. What is necessary for you is not necessary for someone else. When you're determining between sleeve and bypass, it is a very important conversation, and you need to have that conversation with your surgeons and talk about risks and benefits of each and what is necessary for your weight loss goals. I did sleeve. We felt that was the best option for me, and I've had pretty good results. I can't complain. I know people who've done bypass and they've done great. The one thing I wouldn't do is the band. I don't think the band is as effective as some of these surgeries. Yes, vertical sleeve gastrectomy and Roux-en-Y bypass and duodenal switches are much more invasive, but I think they're also more effective. So this video is going on about 10 minutes. It's too long. That's a lot of pre-op stuff and a lot of going into surgery. I've got tons of questions here. If you guys have any questions that I can maybe answer, I don't know if I can. I can try. Hit me up. Message me, YouTube me. I'm Nurse Mike 911 on Twitter, Instagram, YouTube. Mike Isaacs on Facebook, or Michael Isaacs, Michael R. Isaacs, whatever. I'm doing well. Anybody who wants to join me in one of these races, I'm doing the Tough Mudder in October in New Jersey. 13 miles, way too many obstacles. People ask why I do it. Some people play football, some people play volleyball. I do my races. It's like a prize fighting thing. I train for it, I build up to it, and I do the races. I hope everyone's doing great. Anybody who had surgery today, you guys effing rock. You are awesome. Keep it up. Stick to your plans. We are all killing it. And I'll talk to you guys next time. Be good.